Hey everyone, welcome back to my channel, and if you're new here, I am Mariana and I interview the brightest minds of physical therapy. So if you want to increase your knowledge, start right now by subscribing to this channel, clicking on the bell so you don't miss anything, and give us a thumbs up, share with your friends. Today, our guest is Lori Chinitz, and she is a physical therapist, certified healing from the car instructor, and Diplomate Certified CranioSacral Therapist with over 30 years of experience. She's going to talk about CranioSacral Therapy, Visceral Manipulation, healing from the car, and more. I hope you enjoy the show. Hi Lori, welcome to PT Pro Talk. How are you today?
Hi Mariana, it's great to see you.
I'm so glad you could finally meet, so I'm excited to talk a little bit about CranioSacral Therapy and many other topics we're going to talk today. So I really appreciate you taking the time to be with me here today.
Yeah, my pleasure. I've been looking forward to this for a while now.
Yeah, so let's jump right in. So could you share a little bit about your journey and your career and have you done so far?
Sure. Well, it's been a long road. I've been out working for well over 35 years now. So, I won't bore you with all the specific details, but for the most part, when I look back at my career, what I can say is I feel really fortunate because early on, way back in the 80s, I was working in a pediatric setting because I wanted to immerse myself in that community. And I feel like I was just really fortunate because a lot of the other more experienced therapists really held my hand and helped me find different ways that I can move forward. And one of the most impactful one was being introduced very early on to some of what was considered then probably a little more alternative type of healthcare modalities that are really quite standard today. And that's in the realm of what we call craniosacral therapy, myofascial release. Yes, myofascial release was a little bit more fringe back then. And visceral manipulation. And what was really an interesting piece was really in those first 10 years of my career, I just went all in on various forms of going in more deeply with those manual therapies, along with different movement therapies. I had NDT certification. Also really fortunate to have studied with a woman who's no longer here with us, but 𝗔𝗯cie𝘂𝘁, who her work was what's called the TAMO, has now since changed to perceptual action. But she too was an integral person for me to recognize how to really look, feel, understand, and interpret what's going on in terms of movement and body perception. So kind of through it all, especially in those first 10 years, I immersed myself in both pediatrics as well as adult orthopedics, primarily because I wanted to bring that craniosacral aspect into peds, but back then they didn't have standard classes. So I started treating in the adult population as well. And again, it really kept just leading me in this space where I was looking and feeling and understanding that the body is so multi-complex. It is not an isolated set of joints. It's not just a shoulder joint. It's not just a hip joint. It's the old song where everything is really connected to another body part. And going from that perspective, it kind of led me into yet another area where I've been studying and teaching called healing from the core. And the developer with that is 𝗔𝗯ance𝘂𝘁. And I have been studying and working with her for the last 20 years and now teaching the work and all the different levels as we change the curriculum. But to me, the healing from the core aspect of what we are bringing forward is having a place where I can really hold what we call therapeutic presence. I think therapeutic presence is something we all have, and we all have versions of it. But by really taking apart, by understanding what is my role in that therapeutic relationship, really shifted in a way that I was connecting with my clients much more deeply. So my practice started to shift to include people with chronic pain, with more multi-complex issues or traumas of all kinds of nature. And it's kind of led me to where I'm sitting here now, where it's all kind of integrated and really continues to be. After 35 years, I can say it is still such an enjoyable profession that I have never, ever been let down by.
Nice. So a lot of things there. So let's try to separate them a little bit. Just give our audience a little basic understanding about what is craniosacral therapy, what is visceral manipulation, what is healing from the core. So like just briefly, let's summarize for our audience.
Absolutely. So I even though you're studied in two different forms, craniosacral therapy and visceral manipulation, they are considered two different sort of manual modalities. Having studied both of them, I kind of see them as cousins of one another. And I have a lot of gratitude to the Upliger Institute and the Barral Institute, where I think they're the premier institutions to really teach this work. But craniosacral therapy in and of itself is a way by which we are feeling into what we call the craniosacral rhythm. The rhythm is the cerebral spinal fluid that's moving through someone's body. And it's happening whether or not we can feel it, we know it, individually, but we can use that identification of that rhythm as a way to help determine where there are other restrictions in the body. And we feel them through fascial connections, through bony connections, through the energy that's running through our body as well. And it's when we put our hands on, it's a very light touch. It's really the weight of a nickel. And there's a way by listening to the body through our hands, through our internal navigational system, that we can then come up with what I like to call the roadmap of the body, where there are restrictions. So someone that may have had a neck injury, right? They might have had a car accident. Well, they have the pain up in their neck, but the pain now has become chronic. Why? Treating the neck, working the neck, but now this pain doesn't go away. Well, oftentimes it's because there was something else that has now become restricted from that injury. They were wearing a seatbelt. Their ribs became rotated. There was a particular type of whiplash. The sacrum might have rotated. So by being able to really feel into the entire system, I can then expand my ability to really reach out and understand, well, how is one part relating to another? Now, in that line of visceral manipulation, to me, the reason why I call it cousins is because that one is asking us to listen into the organs, because yes, we're not working, the heart specifically, but the heart is held in a pericardium. It's held with all kinds of fascial restrictions, that if I have an injury and my ribs get twisted and my spine gets pulled out, well, guess what? So does that other tissue as well. So even though my heart may be healthy from a standpoint of needing a cardiologist, but I still have pain in my chest, there's a way in which we can actually feel into those very subtle systems and subtle tissues and release it through gentle touch. Just to let you know about that the releasing in this system, what's really cool and I love about it is very self-corrected. It's typically more indirect, meaning that I can feel with the person what's going on. Their body leads the way, and then we can feel, hold, wait, and then it lets on and can release. Kind of like where people are probably a little more familiar with myofascial work. There's a direct way and there's a little bit of an indirect way, but it's a very light touch for the most part, unless you're doing certain techniques. It's a light touch where we're feeling into that, that connective tissue that surrounds the muscle itself, and holding, waiting, releasing for it to let go. So it's a way by which, using all these different systems, then we get a much more three-dimensional picture into what's going on with someone's body.
It's just crazy how many more options we have when you start studying these different types of approach. And sometimes you have a patient that a motor vehicle accident, and there is so much in there that sometimes you just are used to, let's treat the back. A lot of us physical therapists sometimes just focus on the joints and on the things that we are more used to treat. And I think it's great just to open these possibilities to many other organs and systems, fascias, and things that we even didn't think about it before.
You're making me think about one thing that one particular injury that I've seen. Well, it's not really quite an injury, but frozen shoulder is something that I will see often. And I will often see it after someone has done an intensive amount of physical therapy. And typically it's not that the traditional model doesn't work. I'm a big believer in a more traditional setting and using all the different possibilities and pieces that each of us can bring to the table. But sometimes what I've seen with something like a frozen shoulder is that PT is kind of looking at it a little more mechanically and a little more abruptly and directly. And sometimes that has a place, but sometimes it actually creates a lot more of an inflammatory response. And frozen shoulder rarely is just the only issue that's going on. I've never seen it where it hasn't affected the other side, a neck, the lower back, through the spine. It's for some reason, and we can talk about why, but this particular shoulder became, immobile. And there's a tendency to see the place where it's the problem, see the place where it's the symptom, and go directly there. And we then have this sort of a more narrow tunnel vision that doesn't expand and let us see that, oh, wait a minute. The neck doesn't have any mobility. This thoracic spine doesn't have any room for movement as well. So, when I go to really treat the arm, a lot of times when I get that after someone's done a longer term rehab approach to it, I actually don't work on the arm much at all initially and work through the surrounding tissues. And oh my goodness, so much more range shows up in the arm. So it's just sort of one example of how when we tend to look at something in a more narrow way, and it's a particular way of training and understanding it that way, that it can also have some consequences that don't assist us.
Yeah, I think it's just great to talk about and give this idea to other PTs that sometimes don't see the big picture, not used to. So I think our area is so big and there are so many possibilities. So I think it's our job to just let people know about it and choose.
That's why I
what
love
path they want to follow.
Absolutely. And one of the things that I love doing is, like, for instance, that frozen shoulder example, I'll have someone come in with that frozen shoulder. I might see them once a week while they're going to a more traditional physical therapy setting. It's not one or the other, because I don't really have the availability of the exercise machines and some of the other modalities that come in really handy. But at the same time, that might not be the only environment that is working. So I often work hand in hand with local therapists around here so that we can offer each other what the other one may not be able to do. Because, I always like to say, let's face it, I'm not here, I can't do everything, nor can anyone else. And that's why there's so many wonderful, wonderful practitioners out there.
Yeah, I think it's a combination of all the techniques, and we as PTs recognize that and be able to refer when you think like we've done our part, the patient hasn't improved anymore. So let's try something different, another alternative. Let's refer them to Lori that has different techniques than what I have.
Right. Yeah, I think it affords the client a lot more options, because, and I'd say a little unfortunately at times, is I tend to get people when they've really been through the mill, when they've, because the kinds of people I'll see will have a lot of multi-complex issues, and whether it's through, inflammatory pieces, autoimmune issues, people that have had head injuries or strokes or post-concussion, that the system seems to have played itself out and they've tried to do one thing or another. That's when they have a tendency to keep looking, those that want to keep looking to find something different. And I would say, what I would love to see is that integration happen even a little bit sooner. So A, people don't have to suffer as much, or B, feeling as though there's not really support. But I think the combined practices of, and I'm a big believer in acupuncture and the good chiropractic care, or whatever people can bring to the table. There's something for everybody.
Yeah. And talking about different approaches and techniques, so let's talk a little bit about trauma and how trauma influences outcomes and where the somato-emotional release fits in.
Absolutely. So in this particular part that you're asking me about, I would love to bring in a huge part of what I think has changed my availability to really sit and be comfortable enough with people that have experienced trauma. And that's through my work with healing from the core. So healing from the core is a way in which we're teaching, and I've learned and I'm now teaching, how to have what we're called therapeutic presence. What is therapeutic presence? My capacity to hold a healing space for someone in a calm, centered, neutral way, in a way that allows me to gain energy rather than become depleted by it. we as therapists, PTs in particular, we don't really talk about this. In other fields, they talk about it more, whether it's in psychotherapy, psychotherapists. I think certain physicians that have to deal with more chronic issues and emotional pieces that come up for them might have had some more dialogue around it. But we as PTs, I know I never received it, really sat back and had to sit with, well, these people, clients are coming in, patients are coming in with pain, family issues, all kinds of traumas that have come up along the way. If I'm not comfortable sitting with that, my older me, my earlier me, probably would have just shut it out and wouldn't left the opportunity or the door open for someone to do some greater healing. It wouldn't have been something that I felt competent with. And yet, really what I'm talking about here in terms of what it means to do with healing from the core is being able to understand, what am I bringing to the table? What are my biases? What's my lens? How do I interpret when a patient says something to me? Do I quickly move into a certain particular judgment? Do I start assessing and making a decision about what I think is needed that's best for them? Those things are natural. Those are the things that we have a tendency to do. However, what that does at the same time is really limits my ability to stay fully present with the person that's showing up, because a lot of times it's not my belief system, it's coming from a different lens. I've made an interpretation that is just a little bit off, even though I think I know better, based on my experience. So it's a way in which, when you're with someone that comes in with that's in a tremendous amount of pain, who's had a traumatic experience, a mugging. I've worked with a client that had, a mugging that was hit on the head. And yes, she had concussive symptoms and problems from that. She also had a fight or flight and now new panic attacks and anxieties that came along with it, that were also interfering with how she was kind of walking through her life and the way she was holding her body. Had I kind of just looked at it from post-concussion symptoms, and that's what happened with other people, she would have only gotten a little bit better or somewhat better, but all of the other symptoms that she was showing up with were likely to still influence her. So I just wanted to bring that in about healing from the core, because when somatoemotional release enters into the experience, somatoemotional release is part of the craniosacral system, and it's a way that we can feel into the tissue with the person that's receiving it, that is able to then identify, through their experience, anything that might still be held in the tissue. So as an example, one person has a car accident, two people have a car accident, both people have equal whiplashes. 3 weeks, one person's whiplash, the pain goes away. The other one, they now have chronic issues. The one whose pain went away, they had a good morning, they left the house, everything was working fine. The one who now has chronic issues, that person had a fight with their spouse, or they were frustrated, or they got angry at something. So one of the ways that this shows up sometimes is that can get, those feelings, the emotions can get lodged into the tissue. So by connecting in, feeling into it, working with that person, using very clear, clean ways to dialogue in an open-ended way. It's not any kind of therapy. It's about just letting someone feel into their own body. There's a way in which they can then release whatever that energetic connection might be, and then their pain ultimately disappears. So it's a very simplistic way of explaining it, but that's kind of what SER, like we like to call it, is in a nutshell.
Yeah, I think it's very interesting to talk about that, because like learning college, we don't feel, as you said, competent to lead, to have this type of conversations with our patients, to deal with this kind of situation. So it's interesting to hear about like a technique that talks about that and gives you some confidence and backgrounds and ways of dealing with this situation. So because we know that our patients are not just the body there, so they are this pain reflects something much bigger than that. It's the whole body that talks, and sometimes we don't pay attention to everything. We just pay attention to that body part, but forget about the whole context. So I think this technique, it's very, very interesting.
Well, and even if you don't, want to study and learn how to do like even craniosacral therapy or spinal motion release for that matter, where I think healing from the core really invites us to go is having more awareness of our own ability to really connect and be available to someone else. Because one of the unfortunate things, I mean, there's a lot of really fortunate things in the medical system, but one of the more unfortunate things is there's a limitation on time. And then the second piece with that is because of the limitation on time and the desire to kind of help and do something. We have this paradigm that we live from as healthcare people that we're supposed to do something, right? We're supposed to heal something. We're supposed to fix something, and the patient that's coming in has that same expectation, like, do something for me, fix me. I'm kind of coming at it from a different paradigm where I'm saying both parties are equally responsible in the relationship. That I'm here to assist and support someone's healing, and they're here to be an integral, active participant in what that means for them. So I don't want to disqualify what the other parts of them that are coming forward, that are showing up, that are interfering or causing issue. If someone I know has lots of anxiety and fear because they have been through so many different practitioners and no one's really been able to help them, and they've got this chronic pain issue, well, I don't want to make all kinds of assumptions that, oh, they're just one of those people, or they're a complainer, or yeah, this is what you got to live with. There's nothing I can do. There's nothing we can do about it. And it might be coming not from an obnoxious place, kind of as a sort of a place of knowing or believing. And what does that do? It really takes away the opportunity for the person to do some of their own healing, to see some different possibilities outside of myself. And then it takes away my ability to really listen and hear, well, maybe I'm missing something here. Maybe there's something else that I can be of some service. And if both of us are equally part of that connection, then I don't have to walk away feeling like, this is what I feel bad that I couldn't help them, or I feel like there's something wrong with me as a therapist that I wasn't smart enough to figure it out. Because there are just times where it takes space and it takes listening and honoring what's showing up to really ultimately figure out with that person, how their healing is best served to move forward.
Yeah, and I think what you said about time, it's one of the limitations we have, at least most PTs that work in traditional clinics, that we are in a hurry to see patients, and then they start talking about it, and then I think we automatically make assumptions of what it is going on, and we don't let them talk, and we don't listen to them because we are in a hurry. And I think most times we think that we know what it is, so we don't really want to pay as much attention. And even we get anxious and have the feeling, the sensation that we have to do something, we want to just jump right there and do something and test and manipulate, and we go trying to treat without understanding and letting the patient really talk about everything. And as you said, sometimes you're missing something that we don't pay attention. So I think it's very important.
It is. And one of the things I when I teach my the healing from the core, the full body presence class, one of the things that we talk about is creating the contract of my relationship to my client. And we all have different contracts. I'm very fortunate. I do 60 minutes. I get a 60-minute session with someone. And that is my contract, meaning that they come in for 60 minutes. There's a fee that I've associated with it. And I set my intention to hold that space in whatever way I can for that period of time. If, however, I only have 10 minutes, 3 minutes, 1.5 minutes, right? I can set my intention for whatever needs to show up with whatever time that I have. So whether you're a busy ER doc, in the emergency room, or a nurse, or a chiropractor that maybe spends 10 minutes in person, or the busy PT, and we all know these clinics and the environments where there's 2 PTs, and God gosh knows how many people are floating in the room there. And your mind, I mean, I haven't worked in those environments in a really long time, but your mind is kind of, you're holding on to what, 6, 7, 8 people maybe at one time, right? So you're multitasking at like warp speed. At the same time, when you have that way, and in healing from the core, we learn different ways to become more embodied. Well, something that we call a grounding and filling exploration, ways that I can actually understand what my own navigational system is picking up, so I can recognize, oh, what's needed right now. I can feel into, when I'm working with someone through my own navigational system, where to begin, what's the greatest restriction, where do I need to go, that's based in sort of greater perceptual skill in my own system, without taking on anyone else's stuff. I'm not going into anyone's body. I'm not taking on anyone's pain. Actually, I'm learning how to really hold that space of pain and be able to then identify what really is best for them. So there's a way in which we can get bogged down, I think, in some of those larger clinics, to get into distraction and dialogue and in the fun of it, and at the same time lose the space and time to really just listen, like you were saying, like really hear what someone's telling you without jumping to a conclusion or starting in. One other thing I like to do is I always say, every patient that comes in to see me, I think of this as the beginning of a book or a dream. I don't know how it's going to end. I do know where chapter I'm in right now. I hear the information, we start working, but I make no assumption that I know exactly what's going to happen along the way, or how I'm going to be able to help happen, and that we are going to explore this all the different chapters along the way until the ending does show up.
And I think that's like a practice, like a conscious effort that we have to do, right? So how did you get to this point? Like, do you have any special thought that you have, or like a process, or like how do you do that?
Yeah. So I would say I've always had a lot of curiosity. And like I said, going back to being introduced to craniosacral work at such an early time in my life, I think is why I've been doing this for so long. But you can enter in at any point. The first piece I'd say is curiosity. I have to be curious to listen, to pay attention, to explore my relationship to myself, my relationship to my client. A lot of times, having taught this now for so many years, one of the first thing I hear from physical therapists when they think of taking the 4-day class that I teach is, sounds great, but I don't have time to do anything for myself. If I'm going to take a class, I need another technique to work on someone else. And I would say it was after about 10 years that I've been working in cranial work, and I was a pretty established practitioner at that point. You're out 10 years. I then was introduced to Suzanne Scurlock's Healing from the Core. In the 2 years that I studied the Healing from the Core work was when I think, for me, the biggest paradigm shift happened, because all the skills I already knew, all the skills I was bringing to the table, suddenly I think the art of the work started to come in. And so what I would say to, how does someone else explore this? Look at what interests you in terms of being able to study, explore, and invite your own self-awareness around your belief systems and things you bring to the table, whether it's through something like Healing from the Core. There's so many other different systems out there as well. There's some great books out there that, that move into this, the reclaiming your body, I think from Suzanne Scurlock, or Full Body Presence. Sorry. But there's so many wonderful books that will help us begin to explore and kind of take that breath back. Whether it's using your own movement techniques, yoga, continuum, breath techniques. Yes, it's for myself, but I always did it that my excuse initially was, this is what I need to use to really help I want to be a better practitioner. And what I realized is, for me to truly be the best practitioner I can be to others, I had to look at some of my own way of existing and sensing and feeling into the world.
Yeah, I think that's very interesting, that we have to take care of ourselves to be able to help others. So I think most PTs don't pay attention to that part. We're always looking for more techniques. I think our healthcare,
unfortunately, yeah. I think, and it's in some respect really no fault to their own. I think healthcare the way we view it right now is it's so vast and it's so big and deep, and everyone's working so hard. And in today's day with COVID, even we are being pushed to the brink of our abilities. And I know that PTs are getting lots of information. I'm starting to see it myself, that there's going to be a tremendous number of people that are going to show it with post-COVID symptoms if they haven't already. And all of us are going to need all hands on deck, I think, for many years to come. And for part of our ability, certainly my own personal ability, to be able to do this as long as I do and be in it, if I don't take care of myself, if I don't willingly look at what's influencing my energy, guess what? I might continue to work, but I'm probably going to get a bit burnt out. And once I start bringing that burnt out part, you can run on an empty tank for a really long time. It's just not good for the car. I can run on an empty tank, but it's just not good for my body, and I don't believe it's of any service to someone else. So whenever anyone tells me, well, I don't have time for me, it doesn't take a lot of time. It just takes a little commitment and curiosity, a little bit of trust to say, okay, I'm going to carve out 10 minutes of my day for silence, or I'm going to make sure I walk 4 times a week. There's ways in which we can offer ourselves the fuel and the energy so that we can bring what we want to bring to the table with our clients in a way that works better for them and us. And I will guarantee both of you will feel better.
Yeah, so that's a great advice. So you kind of already answered my next question. So it was about advice to clinicians that I think you already gave. And do you have any other resource that you recommend? Yes, I heard you talking about the book. There is anything else that you recommend?
So, certainly if any of this work is of interest to you, you can go to healingfromthecore.com. And if you're interested in finding out more about me, there's some information more specifically, if you'll see under, I think, instructors for my Lori Chinitz. You can go to the Upledger, it's called upledger.com, and I think it's the Referrals website. And I think those are 3 to probably start with in terms of just if this is piquing your curiosity. As I said, Full Body Presence by 𝗔𝗯cie𝘂𝘁 and Reclaiming Your Body's Wisdom. Those 2 are great books because it'll give you a sense a little bit more about healing from the core, and there's some really good explorations that you can download and begin to work with as well. And I always say, for me to be in doing this for, I don't know, maybe it's more than 30, I think it's more than 35 years, and to feel still so engaged and excited by it, I figured something's going right. So it's been and continues to be a great journey with a lot of fun in it.
That's awesome. And just the last final question, what personal abilities and qualities do you think are important to become a successful PT? So you already talked about curiosity. Do you have anything else to add there?
I actually, I'm going back to sort of I think a willingness to really sit back and understand that, each and every one of us comes from a particular lens, and sort of like being, I guess there's a humility associated with recognizing I don't have all the answers. I'm doing, I'm trying as best to really connect with someone. So when I think of humility, curiosity, trust, a commitment to, trying to, take care of, what I can, including myself. And I would say the other one is, and I'm not saying that we can all suspend judgment, but really important, that judgment piece that seems so natural to us. When we see a situation, we assess it and we make a judgment. There's a way in which that can really cloud our ability to see what's actually really in front of us. So more importantly than it never happening, it's just more about noticing when it does and being able to have the humility to sit back and just kind of, smile a little bit around it and, keep learning. I mean, the most fun about physical therapy and my career as a PT is that I could study constantly. There's so many new things to learn, and whatever, excites you or interests you, go with it. Just have some fun with it.
Yeah, very true. It's like it's something that never ends. We always are challenged by new patients, and there is always something new to study. And I think it's
and I say that's a difference between boredom and being in the present moment. Because if I feel myself getting bored because I've just now had 7 people come in with the same shoulder injury, chances are I'm not really in the present moment, because each person will present a little differently. And to me, that's the fun part. In my so many years of working, I can still say at the end of a day, gee, I've never really quite seen that. On paper, it might sound similar. But when I really got connected with someone, I realized they're unique. Everybody is uniquely different. So, remembering that as well, that even though, like you said, that there's a way in which we can compartmentalize and put shoulder here and that injury there, each individual person is uniquely their own, signature that comes along with it.
Yeah, for sure. And Lori, for people that want to learn more about you or connect with you, do you have any ways that they can reach out to you?
Sure. Well, on my new website will be coming out hopefully within the next couple of probably like the next 2 months. So in the meantime, you can reach me, and you'll certainly find me on the healingfromthecore.com website under the bios there. That I have a page. If you go to iahp.com, I think it's /Lori Chinitz, you'll see another bio. And certainly a way to reach me is by phone, 516-496-4800, or my email at lschinitz, CHINITZ, @gmail.com. So any one of those ways, if you want to read about me, or if you just want to reach me a little bit, I'm happy to share with you, and you'll see my teaching schedule and where I'll be. Although right now we're only teaching online, and that looks like it's going to be for a while, but eventually one day maybe get back in person sessions. In person.
Hopefully.
Yeah. Hopefully. I know. Hopefully we're turning the corner and vaccines are coming around, but the rest of the world has to be vaccinated besides just healthcare people too. So hopefully the next 6 months.
Yeah. So Lori, thank you so much for taking the time today. We talked a lot about different topics, very interesting. So I really appreciate.
And thank you, Marianne. I'm loving what you're doing. I think you're bringing a really important piece that's interesting for other therapists to hear, all different avenues. I know I've listened to some of your other podcasts, and I think it's great that you're bringing this forward. So thank you for doing it.